Hello, my name is Alandria Wilson. The title of my presentation is The Role of the Advanced Population Health Nurse in Caring for the Stroke Patient. The population interests which I chose are individuals who are at risk for their first or recurrent stroke. Strokes are the fifth leading cause of death in the United States. According to the Centers for Disease Control and Prevention, strokes kill approximately 140,000 Americans yearly, and more than 795,000 Americans are diagnosed with strokes yearly. Men and African Americans are at a higher incidence of stroke, and individuals age 55 are diagnosed with stroke at a higher rate than those that are younger. The issue of concern is the number of individuals who are being admitted to the hospital that are at risk for their first or recurrent stroke. Strokes are prevalent in the southeastern United States. Patients that survive an ischemic stroke, or TIA, are at an increased risk of having a recurrent stroke within a few days or weeks of the initial event. 1 in 4 stroke survivors will have a recurrent stroke. There are 5 sub-roles of the advanced population health nurse. They are clinician, educator, researcher, advocate, and collaborator. The clinician ensures that health services are provided to the population and promotes wellness. They work to prevent tobacco use and encourage cessation of smoking of others to improve health and quality of life of individuals. The collaborator commits to organizations to achieve a common goal. They provide information and share resources to promote and protect the health of the stroke population. The researcher describes and monitors health events through systematic collection, analysis, and interpretation of health data. They work to develop and design protocols that the clinical research coordinators for stroke trials use when enrolling patients. The educator communicates to the stroke population about the facts, ideas, and skills that can change the beliefs, behaviors, attitudes, and knowledge of individuals within the population. Educators develop educational programs such as health fairs about the risk factors of stroke, signs and symptoms of stroke, and the importance of taking medications as prescribed. Advocates focus on developing the stroke population capacities to plead their cause or act on their behalf. Advocates strive to make sure that the stroke patients gain greater independence. Healthy People 2030 is working on educational and community-based programs which has an objective to increase the number of community-based organizations that will provide population-based primary prevention services to populations. These services will help combat the number of patients who suffer from second stroke. There are interventions for each sub-role. The clinician ensures that stroke population receives clinical preventive services. The educator participates in health teachings of the stroke patient. The researcher surveys a health problem and collects and analyzes data. The advocate ensures that there is adequate, accessible, and just resources available to those within the population. And the collaborator mobilizes community partnerships to identify and solve the recurrent strokes in previous stroke patients. Strokes are prevalent in the United States. Individuals that are at greater risk of having stroke within the first 2 days after a stroke. However, one remains susceptible for having a stroke up to 3 months or even a year. The treatment for individuals who have had stroke is secondary prevention, and there is a lot of literature out there about secondary prevention of strokes. The first piece of evidence I would like to introduce to you is an article by Arsavar. In 2016, they organized a cohort study to identify patients that are at high risk for developing stroke. The results showed that 59 patients had a recurrent stroke. And the main conclusion that came from this study was that the RRE was useful in predicting those who are considered high or low risk of having a recurrent stroke. Evidence 2 is an article by Verturi and Gagalard in 2016. They conducted a trial to create a real-world data about relationships between secondary prevention of stroke and statin use. And the conclusion of the study found that high doses of the drug simvastatin proved to be most effective treatment to improve stroke prognosis. Evidence 3 is an article by Zhang, and in 2017, they provided a systematic review and meta-analysis to determine if those who have minor strokes or transient ischemic attacks are at risk of having recurrent stroke. The results from this review found that short-term use of the dual antiplatelets aspirin Plavix compared to aspirin Plavix alone were more likely to reduce the risk of recurrent stroke. The article by Vittori and Gagliardi is a level 4. The article by Zhang, level 1. And the article by Arsava is a level 4 as well. There are primary, secondary, and tertiary prevention efforts. Primary prevention is targeted towards those who are at risk for stroke. Primary prevention efforts are to encourage the population to make lifestyle and diet modifications. Secondary prevention is targeted towards individuals who have risk factors but may be currently asymptomatic. The goal is to prevent a recurrent stroke. Tertiary prevention plays an important role in preventing recurrent strokes. Basically, it is to continue care and management of complications that can lead to one having a stroke. The most effective interventions within the sub roles are for the clinician is to work to identify those who are at risk for stroke within the population. The educator organizes health clinics to provide information to the population and those that are at risk for stroke. The collaborator collaborates with community resources and case managers to help those within the stroke population. The researcher works towards finding which procedures, medications, and rehab therapies will be beneficial to those diagnosed with stroke. And the advocate puts the patient in contact with resources that will aid in improvement. The nursing theories which I chose that will support the interventions of the advanced population health nurse within the stroke populations is Hildegard E. Paklou. Her theory of interpersonal relations focuses on the nurse's role to help others identify their difficulties. Her theory is based on the concept that nursing is interpersonal and involves interaction between two or more individuals. And she identifies the role of the educator, collaborator, clinician, advocate, and researcher. The stroke population in Montgomery, Alabama continues to grow. The stroke population includes those who have suffered from strokes and those who are at risk for stroke. The stroke population is different from others because of the comorbidities that are associated with the stroke. There may be speech, physical, and occupational deficits which may follow. The priority education plan is to address the issue of stroke head on within the community. The education plan is based on the needs of the assessment of the stroke population and is to provide education to the patient in a clinical setting. The education plan aims to focus on controlling high blood pressure and cholesterol levels while increasing awareness of signs and symptoms of stroke, encouraging the need to call 911, and eliminating health disparities. The education handout provides the reader with basic information of what a stroke is, its risk factors, signs and symptoms, and treatment and prevention. The brochure does meet health literacy standard. It is on the 8th grade reading level, and the comprehension is conversational English. Montgomery is the capital city of the state of Alabama, and it's the county seat of Montgomery County. Montgomery is centrally located, and it is the fourth largest metropolitan area in Alabama. Montgomery has been the site of major historic events which have shaped the history of the United States, such as the Civil Rights Movement. It is also home to major institutions, corporations such as Maxwell Air Force Base and Hyundai Motor Manufacturing. The local government structure is mayor, city council government. Key leaders in the area are Mayor Reed and Kay Ivey. Mayor Reed he did a citywide curfew and did the mask mandate for Montgomery ahead of the statewide mandate for COVID-19. And Governor Ivey, she did her initial mandate on July 25th and has now been extended for April 9th, 2021. U.S. Congress representation. Senator Richard Shelby is a Republican. Senator Tommy Tuberville is a Republican, and we have Representative Barry Moore as a Republican. And there are many individuals within the state representation and party affiliation for Montgomery. The dietary guidelines for Americans, broadening and evidence-based applicability and implementation to advance public health, is a policy that focuses on the relationship between nutrition and human health. There's also an updated National Physical Activity Plan, which was implemented on November 7, 2020, which focuses on physical activity and chronic diseases. The Code of Ethics Provision 2 states that the nurse primary commitment is to the patient. The patient is considered as an individual, family, group, community, or population. The goal is to address the health of the patient and the public, and the advanced population health nurse must be able to collaborate with nutritionists to help those within the stroke population. As far as health advocacy, the advanced population health nurse can collaborate with target groups and community leaders, implement health policies, implement dietary improvements, and utilize My Plate app. For Montgomery, Alabama, blacks or African American alone make up 59.3%. Whites alone account for 35.5%. The unemployment rate for Montgomery, Alabama is 7.3. According to the Alabama Department of Public Health, the 5 most common major chronic diseases are heart disease, cancer, stroke, diabetes, and arthritis. The leading causes of death in Alabama are cardiovascular disease, cancer, chronic lower respiratory disease, stroke, and accidents. While doing a summary of the windshield survey, it was found that access to health care, recreation, exercise, food, community resources, and public safety were all available in Montgomery. Beverly West, the stroke coordinator at Baptist Medical Center South, has found that she believes that one of the main reasons people are readmitted to the hospital for a recurrent stroke is because they're not following up with their neurologist or primary care physician follow-up. Mila Thomas, the educator at Baptist Medical Center South, found that readmission of patients is being due to not receiving adequate education and instructions at discharge. A priority community diagnosis for the stroke population is ineffective health maintenance characterized by failure to attend follow-up appointments with primary care physicians and or neurologists. Another is the lack of knowledge of stroke regarding signs and symptoms of stroke and stroke risk factors related to lack of exposure and unfamiliarity with information resources. And the third is for the ineffective health maintenance related to socioeconomic factors. The priority community diagnosis is knowledge deficiency of stroke regarding the signs and symptoms of stroke and stroke risk factors related to lack of exposure and unfamiliarity with information resources. And the goal for the education plan is to present an evidence-based education plan within the hospitalized stroke patient population to prevent the first in those who are at risk and recurrent stroke for those who've had a previous stroke. Behavior individual interventions include educating those in population about the importance of lifestyle changes. Educational interventions at the community level are to improve the knowledge of individuals about stroke, improve health monitoring, and maintain behavioral changes for healthy lifestyle. There are 3 measurable objectives I have. The first is a patient will be able to verbalize the signs and symptoms of stroke and what to do if said symptoms occur. Second, the patient will have a full understanding of their risk factors of stroke. And third, the patient will be able to verbalize what lifestyle modifications can be made to lessen the risk of stroke. I developed a stroke booklet for the patient, which will be given to patients who are on the neuroscience floor of Baptist Medical Center South. And what I did was I looked at the patient's H&P, their radiology reports, as well as their vital signs trends and lab trends to determine which will be the best candidates for the education. And the next step was to spend at least 30 minutes of time to educate that patient and to specifically talk about their specific risk factors for stroke. Potential resources, of course, will be staff resources and financial costs such as the printing and binding of the stroke booklet. Barriers and challenges are unwillingness to participate, no family being present, time constraints, and language differences. Team members are the staff, educator, and most importantly, the patient, because the patient is why we're here to give them the information needed to prevent first or recurrent strokes. Key stakeholder, of course, will be Ms. Beverly West, who is the stroke coordinator. And like I said, the main stakeholder will be the patients, because we're here to provide them with the information necessarily so that they can prevent their first or recurrent strokes. And also just to give the population information which can be handed to others to know what those signs and symptoms of strokes are. So if they do have a family of loved one who's starting to show those symptoms, let them know, hey, we need to get you to the hospital as quick as possible because you might be having a stroke. And the end.